So if you were to walk into a clinic today for like one of the most cutting-edge intimate health treatments on the market, you might expect a needle.
Right. Yeah. You'd assume it's an injection.
Exactly. But they aren't going to use a needle. And the biological messengers they use to literally rebuild your tissue, uh, they might actually be extracted from a rose.
Which, I mean, it immediately sounds like science fiction.
Totally.
Or, maybe just a very expensive wellness scam. But when you look at the actual clinical data, this is rooted in deeply complex, incredibly potent cellular biology.
Yeah, and we have a really fascinating stack of sources to guide you through this today.
We do.
We're looking at clinical guidelines from aesthetic medicine practices, some detailed treatment breakdowns from global women's health clinics.
Like the Bioscience Institute, right?
Exactly. Plus, we've got insights on energy-based devices from Joylux and some very sobering patient safety warnings coming out of the UK.
Very important warning.
Yeah. So our mission for you in this deep dive is to basically cut through all that heavy clinical jargon. We want to give you a definitive, step-by-step roadmap of exactly what to expect if you were to actually walk into a clinic for an intimate exosome treatment.
Right, from the biology to the chair.
Yep. The underlying biology, the consultation, the reality of the treatment chair, the recovery, and, how to navigate what is currently a bit of a regulatory Wild West.
And that roadmap is vital, right? Because the aesthetic and intimate health market is just moving much faster than the average consumer's understanding of the science.
Oh, 100%.
If you don't understand the mechanisms of action here, like not just what is happening to your tissue, but the precise cellular reasons why it's happening, you really can't be an empowered patient.
Right. Okay, let's unpack this because the word exosome is like everywhere right now.
Oh, yeah. It's the biggest buzzword.
And it's usually in the exact same sentence as stem cells. Reading through the Bioscience Institute breakdown, it honestly seems like some clinics are intentionally blurring the lines between the two for marketing purposes.
Oh, absolutely they are.
But just to be clear, we aren't talking about injecting living cells into the body here, are we?
We absolutely are not. And honestly, that distinction is the foundation of this entire procedure.
Okay.
Exosomes are not cells. They are extracellular vesicles.
Wait, what does that actually mean?
So to visualize this, imagine something incredibly microscopic. We're talking between 30 to 150 nanometers in diameter.
Wow, so tiny.
Tiny. They are just little lipid-bound envelopes. They don't have their own internal machinery to reproduce. They don't consume energy. They aren't alive.
Not alive at all.
Right. They're secreted by cells, including stem cells, but they are literally just the packaging.
Okay, well, if they aren't alive and they can't reproduce, what is the point of putting them in a human body? I mean, they just sound like empty bubbles.
Well, they are far from empty. Their entire purpose is communication.
Okay.
They carry this highly concentrated payload of proteins, lipids, messenger RNA, and specific growth factors.
So they're carrying messages.
Exactly. They ferry these signaling molecules from one cell to another. And when an exosome reaches a target cell, its lipid envelope basically fuses with the outer membrane of that recipient cell.
Oh, it merges with it.
Yeah, and it dumps its instructions inside, physically telling that cell how to behave, how to repair, and how to regenerate.
Let me try to visualize this. If I have, say, a crumbling brick wall,
Okay, I like this.
and a stem cell is a bricklayer that I hire to come to the site and start laying bricks. So an exosome is more like, is it like sending a manual to the site?
You're close, but it's a bit more active than just a manual.
Okay, how so?
Think of it like sending a project manager's encrypted text messages and blueprints directly to the local workers who are already hanging around the site but have just been slacking off.
Oh, that makes total sense.
Yeah, you aren't hiring an outside labor force. You are giving highly specific, urgent instructions to your own existing cells, telling them precisely how much collagen to produce and, where to route the new plumbing.
Right. And because you aren't introducing foreign living cells, you dramatically lower the risk of your body's immune system just freaking out and attacking the treatment.
Exactly. The safety profile changes completely.
Which brings us to the actual application. Why are people seeking this out for intimate health specifically? The sources point to some pretty heavy quality of life issues.
Yeah, very significant ones.
Things like genitourinary syndrome of menopause or GSM, postpartum tissue tearing, stress, urinary incontinence, and sexual dysfunction.
Mostly caused by severe tissue thinning and dryness.
Right.
Well, look at the underlying cause of those conditions, specifically something like GSM. When estrogen drops during menopause, the local blood vessels in the vaginal tissue physically begin to collapse.
They just recede.
Yeah, they recede. And without blood flow, the tissue thins out, it loses its elasticity, and it just stops producing natural lubrication.
So it's a structural failure.
Exactly. The exosome payload directly targets that structural collapse. The Bioscience Institute data heavily emphasizes that exosomes promote angiogenesis.
Yeah, I saw that word angiogenesis.
Yeah.
Break down the actual mechanism there. How do these little envelopes build blood vessels?
So inside the exosome payload are these specific pro-angiogenic factors, primarily something called VEGF.
VEGF. What's that?
It stands for vascular endothelial growth factor. And when the exosomes fuse with the endothelial cells that line your blood vessels, that VEGF acts as a chemical siren.
A siren.
Yeah, it literally forces those cells to start dividing and sprouting new tiny blood vessel branches.
Oh.
You are physically rebuilding the microvascular network in the tissue.
That's wild. So new plumbing means fresh blood flow.
Yep.
And fresh blood flow brings oxygen and nutrients, which reverses the thinning and the dryness. It's not just like a Band-Aid or a temporary lubricant.
No, not at all.
It's basically instructing the tissue to reverse its own aging process.
Precisely. And in addition to the VEGF, these messengers carry instructions that wake up the fibroblasts.
Those are the cells responsible for synthesizing new collagen and elastin.
Yeah, exactly. They even contain molecules that help regulate the local pH, which is your primary against bacterial and fungal infections. It's really a comprehensive cellular level restoration.
Honestly, if you're listening to this and thinking this sounds way too good to be true, you definitely aren't alone. Which is exactly why we need to look at the clinical safety warnings and what actually happens when you walk into a clinic.
Yes, the reality check.
Right. So you've read the science, you booked an appointment. Step one is the consultation. And the documentation from the Women's Health Clinic in the UK emphasizes something they call evidence-aware care.
Which is so critical.
Yeah, this isn't just a quick chat while you sign a waiver, is it?
No. A qualified practitioner must meticulously review your medical history because, frankly, pumping a concentrated dose of cellular blueprints into an area isn't always safe.
The sources list some immediate hard stops.
They do. If you have unexplained vaginal bleeding, active infection symptoms, severe pelvic pain, or, crucially, any suspected malignancy, the process must halt immediately.
So no treatment today.
Right. You require a medical review before proceeding.
I want to dig into that malignancy warning. It makes a lot of sense biologically.
It really does.
If you have an active, undiagnosed cancer in the pelvic region, and you introduce millions of growth factors and instructions that scream, build new blood vessels and grow new tissue, I mean, you could inadvertently be giving those instructions to the cancer cells.
That is the exact clinical fear. Tumors require a massive blood supply to grow.
Right.
So introducing VEGF into an environment with a suspected malignancy is incredibly dangerous. The consultation is designed to ensure the treatment won't feed a pre-existing harmful condition.
And beyond safety, there is a diagnostic element to the consultation too, right?
What's fascinating here is that the practitioner needs to figure out if exosomes are even the right tool for the job.
Yeah, like if your intimacy issues or pelvic pain are stemming from deep pelvic floor muscle dysfunction.
Or if the root cause is psychosexual trauma.
Right. Throwing cellular blueprints at the vaginal wall isn't going to fix the underlying problem there.
Exactly. It requires a really holistic assessment. And if you are cleared, you will be given some physical prep instructions.
Like what?
Well, you might be asked to stop taking blood-thinning supplements a few days prior, avoid retinoids if they are treating any surrounding external skin, and you'll likely need to shave the treatment area beforehand.
Okay, so you pass the consultation, you do the prep, and you are finally in the treatment chair.
Right.
Now, this is where I hit a massive wall in the source material regarding the actual delivery method.
Ah, yes, the plot twist.
Yeah. I just assumed this was an injection. You know, you draw the exosome liquid into a syringe and inject it right into the vaginal wall.
That's what most people think.
But the clinical safety warnings, particularly from the UK, explicitly state that human-derived exosomes cannot legally be injected under the skin for aesthetic or regenerative purposes.
No, they can't. The regulations around injecting biological material are incredibly strict, as they should be.
Okay.
In many regions, injecting an exosome product classifies it as a medicinal product, requiring a completely different level of licensing and clinical trials that most aesthetic products simply do not have yet.
Wait, if the practitioner isn't using a needle, how on earth do these nanomessengers get deep into the vaginal tissue to do all this cellular repair?
It's a great question.
Because you can't just apply a topical serum to the surface of the vaginal wall and expect it to rebuild deep tissue. The surface barrier is designed to keep things out.
That's the challenge.
I mean, I'm imagining trying to water the roots of a plant by just throwing water onto a concrete driveway. It's just going to sit there.
I love that analogy. It's like aerating a lawn before you put down fertilizer, right?
Yes, exactly.
To bypass the injection restrictions and still force that deep tissue penetration, practitioners have to physically alter the landscape of the tissue before applying the exosomes.
By using energy-based devices.
Yes. They utilize energy-based devices to create microchannels.
The sources mentioned a few specific technologies for this. There's microneedling, radiofrequency devices like Morpheus 8 or Votiva.
Yep, and laser resurfacing like CO2 or ERYAG lasers.
Well, let's look at the lasers because the Joylux source specifically breaks down how these energy-based devices interact with the tissue.
It's really interesting biology.
It's not just burning a hole, right?
Yeah.
He works on the concept of water absorption.
Mm.
What does that actually mean for the patient sitting in the chair?
Well, your practitioner will start by applying a topical numbing cream to the area.
Okay, good to know.
Once that takes effect, they insert a specialized wand into the vaginal canal. The laser energy emitted from that wand is specifically attracted to the water molecules within your connective tissue.
Okay.
And when the laser hits that water, it vaporizes it instantly.
Vaporizing water inside the tissue. That sounds so aggressive.
It sounds scary, but the numbing cream makes it highly tolerable. Most patients report feeling a warm, prickling sensation rather than pain.
Oh, right.
But beneath the surface, that targeted vaporization is creating controlled thermal edema, basically heat-induced swelling.
So you are intentionally causing a microscopic, highly controlled burn injury to the tissue.
Exactly. You are intentionally damaging the tissue to trigger a healing response. The body senses the burn, sounds the alarm, and wakes up the fibroblasts to come fix the damage.
And in doing that, you've created thousands of tiny microscopic injuries, those microchannels.
Spot on. And the moment those microchannels are open, the practitioner takes the highly concentrated exosome solution and massages it topically right into the tissue.
Because the physical barrier has been breached by the laser.
Yes, those little lipid envelopes slide right down into the deep connective tissue.
Wow. The sources describe them acting as behind-the-scenes repair technicians.
That's a perfect way to describe it.
Like, the laser started the fire alarm, but the exosomes show up immediately with the exact chemical blueprints to fix the damage efficiently.
Right. They calm the massive inflammation caused by the laser, and they supercharge the neocollagenesis. The synergy between the two is why this is such a breakthrough.
Okay, I see.
If you just use the laser, you get a good regenerative response, but it takes time and comes with significant inflammation.
And if you just use exosomes topically,
They can't penetrate deep enough, but combine them, and the device creates the physical pathway, while the exosomes deliver the biological instructions to make the repair faster, vastly more robust, and with far less downtime.
let's talk about that downtime, actually.
Mm.
So the treatment itself takes, what, about 30 to 60 minutes?
Yeah, about that.
You get out of the chair and leave the clinic. What is the physical reality of the next few days?
Because the exosomes are rapidly signaling your cells to downregulate inflammation, the immediate downtime is surprisingly minimal. You will likely experience mild redness, maybe slight swelling or sensitivity.
But there is a critical 48-hour window where you have to be very disciplined.
Oh, extremely disciplined.
The rules in the clinical guidelines are strict. For 48 hours, you have to avoid excessive heat.
No saunas, no hot tubs.
Right. No swimming because you have open micro wounds, and chlorine or bacteria are a massive infection risk.
Definitely no heavy sweat-inducing workouts.
And absolutely no intimacy.
Yeah.
You have to give the tissue an undisturbed environment to let the exosomes bind to their targets and begin that chemical cascade.
Yep. But patients always want to know the timeline. They want to know when the problem they came in with will actually be fixed.
So what does this all mean for the timeline? When do I see a difference? Like, I do this on a Friday. What happens by Monday? Do I feel different?
By Monday, you might experience the quick wins.
Okay.
Within the first few days to a week, the exosome payload often triggers a rapid improvement in local hydration and a noticeable reduction in external dryness.
Nice.
The tissue will just feel calmer, but the heavy lifting, the structural changes, that takes time.
Because the body still has to physically manufacture the proteins.
Right. Over the next 2 to 6 weeks, that neocollagenesis kicks into high gear. You begin to notice actual tissue firming and a return of elasticity.
Which takes time to build a vascular network.
Exactly. You won't hit peak results until between 1 to 3 months post-treatment.
The clinical data suggests those benefits can last anywhere from 9 to 12 months, sometimes longer, depending on your baseline health.
And clinics usually recommend a maintenance session around the 1-year mark to keep the cellular signaling active.
So the results sound incredible, but because the claims are so bold and the market is just so lucrative, we need to arm you with some critical thinking before you would ever book an appointment.
Very true.
Because the sourcing of these exosomes is incredibly controversial.
This is perhaps the most crucial piece of information for a prospective patient. Not all exosomes are the same.
Okay.
A clinic like the Bioscience Institute utilizes human adipose-derived mesenchymal stem cell exosomes.
That's a mouthful.
Yeah, it basically means they take human fat tissue, extract the mesenchymal stem cells, culture them in a highly controlled laboratory, and harvest the exosomes they secrete.
But as we noted earlier, in places like the UK, human-derived exosomes are not legal for aesthetic use.
Right.
So clinics wanting to offer these advanced treatments legally are forced to find workarounds. And this brings me to the detail in our sources that literally made me pause and reread the paragraph 3 times.
I know what you're going to say.
To get around the ban on human products, some clinics are using exosomes extracted from roses.
Yes, plant-derived exosomes.
I mean, a rose and a human are biologically fundamentally different. We belong to entirely different kingdoms of life. How can a vesicle from a flower possibly know how to tell a human vaginal wall to produce collagen? That sounds exactly like marketing pseudoscience.
It completely strains credulity until you look at the mechanism of cross-kingdom communication.
Cross-kingdom communication?
Yes. At a molecular level, the lipid envelopes and the messenger RNA within them act as a universal biological language. Yeah. The structural makeup of a plant exosome is remarkably similar to a mammalian exosome. When applied to human tissue, human cells recognize the lipid structure.
Wow.
They allow the vesicle to fuse with their membrane, and they just read the RNA payload.
That's wild.
The clinical data actually confirms that these rose-derived exosomes actively stimulate human fibroblasts to increase collagen and elastin production.
While also delivering antioxidant effects.
Exactly.
It's mind-bending. Our cells are just reading the raw code, regardless of where the code was written.
Nature is pretty amazing like that.
It really is. Now, there are other treatments mentioned in the sources that patients will likely encounter when researching this. You hear a lot about the O-shot, which uses PRP, or platelet-rich plasma.
Right, very popular.
And then there are polynucleotides, which are derived from salmon sperm DNA.
Also gaining a lot of traction.
How do these compare biologically to an exosome treatment?
Well, the O-shot is a classic autologous treatment.
Meaning from your own body.
Yep. They draw your own blood, spin it in a centrifuge to isolate the platelets, and inject those platelets back into the vaginal tissue to release growth factors.
Okay, so because it's your own blood, there is zero risk of rejection.
Exactly. But the massive variable is quality control.
Oh, I see.
If you are 60 years old, dealing with systemic inflammation, high stress, poor sleep, the growth factors in your blood are not going to be nearly as potent or concentrated as a lab-derived exosome product.
That makes sense. Exosomes offer a guaranteed massive dose of active messengers every single time.
Exactly.
And what about the salmon sperm DNA? What is the biological mechanism behind injecting that into human tissue?
So polynucleotides are highly purified fragments of DNA, and when introduced into the tissue, they don't alter your genetic code at all.
Okay, that's reassuring.
Yeah. Instead, these long DNA chains act as intense water magnets.
Oh.
They bind to water molecules, dramatically increasing tissue hydration, and they scavenge free radicals, which cleans up oxidative stress.
Was it?
And as enzymes in your body slowly break down these DNA chains, they release individual nucleotides that bind to specific receptors on your cells, specifically the CD39 receptor, which further stimulates fibroblast activity.
So they are essentially prepping the soil. The sources note that practitioners will often stack these treatments.
They do, yeah.
Like they use the salmon DNA polynucleotides to deeply hydrate and prime the tissue, and then use the exosomes to deliver the targeted architectural blueprints for repair.
They work beautifully in tandem, provided they are legally sourced and sterile.
Right.
If we connect this to the bigger picture, this brings us to the ultimate takeaway for the listener. You have to advocate for yourself in that consultation room.
100%. You must ask the practitioner exactly what product they're using. Where are these exosomes sourced? Are they human or plant?
Are they legally cleared for aesthetic use in this country?
Right. Can you provide the sterility and lot certifications?
And if a practitioner brushes those questions off, or if you feel pressured into a procedure without a transparent explanation of the regulatory status of the vial they're holding, you stand up and walk out.
You are under absolutely no obligation to sit in that chair. You have every right to demand evidence-aware care.
Absolutely.
Well, to summarize the roadmap we've built today, we've explored how microscopic lipid-bound messengers are shifting the paradigm of intimate health from surgical intervention to cellular communication.
That's a huge shift.
We've seen how they bypass the need for needles through the clever use of energy-based devices like lasers, vaporizing water, to create microchannels that allow the exosomes to dive deep into the vaginal wall.
And begin that weeks-long process of neocollagenesis.
And we've unpacked the complex reality of human versus plant sourcing in a rapidly evolving regulatory landscape.
It really is a profound shift in how we approach tissue aging and damage. Just harnessing the body's own communication networks to restore function and comfort without major surgery.
It's an incredible frontier. But before we sign off, I want to leave you with a thought to mull over. Something that has been stuck in my head since we unpacked the science of the plant alternatives.
Yeah.
We just spent this entire deep dive discussing how microscopic vesicles extracted from something as simple as a rose can literally be massaged into human tissue, fuse with human cell membranes, and successfully instruct our bodies to build collagen and repair damage.
It's pretty wild.
It completely shatters the rigid walls of what we think of as distinct human biology. It makes you wonder, if our human cells are already so fluent in the chemical language of plants at a microscopic level, reading their RNA code like it's our own, what other invisible cross-species conversations are happening inside us every single time we eat, breathe, or touch the natural world without us even realizing it?
That is a fascinating thought.
We'll catch you on the next Deep Dive.